I'm going to speak about two things. Number one, I'm going to speak about living. And number two, I'm going to speak about life. And when it comes to living and life, the only example that I'm going to use for this afternoon is going to be me and none other than me. You can take a lot of points as to how one should be, and you can take lots and lots of points as to how one should not be through my examples. Ages 1 to 16. This is the age when we do not have restrictions. The age when we are given our freedom. I was no different from any of you, probably a little more scandalous than most of you. I did all the things that any normal and yet mischievous kid would do. During the adolescent period, during the growing up phase, I learned all the good and the bad things. So I took up medicine. So that fear factor set in, and I thought, okay, fine, let me just let this slide. I think I've taken the wrong profession, even though I have the interest in it. And in any case, I know what the result is. I'm going to be useless anyway at the end of my medical course. So at least let me enjoy my medical course. So I did not study, and I was doing everything else. I studied little, and probably whatever little I studied was right. But then predominantly I was not studying, I was just having fun. I realized that doing the right thing is great. Doing the wrong thing is pardonable. But not knowing whether you've done the right thing or wrong thing is a crime. So I knew I was ignorant, and I wanted to eradicate the darkness of ignorance around me. So what I did, from that point onwards, I told myself, Manoj Beno, had your share of fun in life, you can still have fun in life, but then get your priorities right. One day, one lady came to me, and she said, vomiting doctor, loose motion doctor. So I thought, okay, fine, I examined her. I thought, okay, fine, this lady is a case of dehydration. Now, in any private clinic, if you give injections, you charge some money. If you give tablets, you charge some money. But if you start an IV line and give that person, a saline or a glucose, then you can charge a little more money because it's like a small hospital setup. So I tried starting a simple IV line. How many of you here have gotten an IV line done on yourselves in the past? Okay, quite a few. So I tried starting a simple IV line. A central line is an IV line which goes through the neck to the heart. Okay? I tried doing the simple IV line. I failed. I tried once, I failed. I tried twice, I failed. I tried thrice, I failed. The hand of the lady bulged like this. I gave her the medicines. I went home that night. I cried because one of life's important lessons that I've learned is you can lose sleep because you're upset, but never lose sleep because you're guilty. Being unable to sleep because you're upset is pardonable. We all get upset. But if you're guilty and if you've done something wrong, that is what you should not be having. So I decided that I'm still lacking in the basics. In anything, take it, be it the field of medicine, be it the field of engineering, be it the field of IT, anything at all, you have to make sure that you have your basics and your foundation right. I went next day to my hospital where I was working. I called the nurse. The nurse immediately said, okay, sir, okay, doctor, I have that central line ready for you. I said, no, you come here. Bring the IV set. And then she said, what, doctor? You want me to put it for this patient? I said, no, I'm going to put, you teach me. I said, I do not know. And that was the honesty that every profession demands. When you know something, go gung-ho. Go full steam ahead and say you know it. When you don't know something, especially something that deals with human lives, something that deals with hospitality industry, something that deals with the faith that somebody else has put into you, okay? Admit what you do not know. I admitted, I learned. And I have never made that mistake ever again. When I was about 17 years, I saw something on TV. It was a program that Rajinikanth had done with his wife and few other group artists, etc., etc. It was a stage show. And then Rajinikanth came on stage and he said something. I registered that when I was 17 years old. I put that to practice only when I was 25 years old. What he said was beautiful. He said, between ages 1 and 10, you do not even know to play. Between ages 10 and 20, you start learning how to play. Between 20 and 30, you know how to play, and that is when you play. Rajinikanth said, if you want to play, push it to 30 or do it before 20, because 20 to 30 is the golden age of your life. If during that golden age, that golden period, you do not get your focus right, if you do not do that, then you cannot play even if you wanted to ever again. So he said, don't lose that golden period of your life. I saw this at 17. We all get taught a lot of good things, but do we put it to practice? We do not, right? So until 25, I did not take it seriously. At 25, when I got all these things, these lessons which came to me in my life, that is when I thought, okay, see, this is what Rajinikanth said. So this is the time that I have to really buck up and update myself and qualify myself so that later on I'll be able to reap the harvest. While I was in the hospital, now this is where that physical health part comes in. While I was in the hospital, one cardiac arrest patient came. The age of the patient is 30 years. He was traveling from the US to Chennai. He was here for a vacation. He was an obese guy. His mom brings him to the hospital. Usually at 30 years, somebody comes, we call it, we treat it as gastritis. We do not think it is cardiac. At 30 years, usually people get only gastritic discomfort. So we tried giving him a Pantocid and tried to see if the pain settles down. It did not. So we thought something was wrong. We took an ECG and it was a full-blown cardiac arrest. I went and told the mom of the guy, I'm sorry to say, your son has a cardiac arrest. And then she said, how? Today, unlike earlier days, 40, 45, 50 years, the risk age for cardiac arrest have stooped down to as low as 30. There are about 7 risk factors for cardiac arrest. The most common of them being cholesterol, obesity, sedentary life habit, as in no exercise, diabetes, family history, blood pressure. Now that guy had 4 out of 7 factors and he was obese. And he was obese obviously because of his westernized diet. And when I told the mom that your son is fat, he is obese, and that is one of the risk factors, and that is why he could have gotten this cardiac arrest. At that point, when I was talking to her, was weighing 114 kgs with a 44 waistline. I'm not kidding. To give an example to others, you have to set an example first. In 9 months, I lost 32 kgs and 10 inches of my waistline only by physical exercise and dieting. No shortcuts. There are people who have thyroid problems. There are people who have physical conditions where even if you tried, you cannot lose weight. But as for me, I had not tried. And I'm sure that most of you have not tried either, at least sincerely. According to me, if you try sincerely, 90% of obesity can definitely be corrected. It is only that rare 10%, who need extra help in the form of a surgery or medications for thyroid or treatment for diabetes, etc., etc. Now I spoke about phases of my life where I had freedom, where I had uncertainty, where I was exposed to pain, suffering, etc., etc., where I had lack of confidence, and then where I developed confidence. Now let me go into the later stages of my life. One day my folks came and asked me, you're being very stagnant, what are you going to do with your life? I said, why? I'm in a job, I'm doing some private practice. They said, see, but you are our son. We have a bigger purpose for you. you have to aim higher in life. You can't be just drawing one salary and seeing 20 to 30 patients every day. So what else are you going to do? I said, nothing, I don't want to do anything. They said, no, 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 you have to do something. You have to take up a PG course. We cannot afford to buy you a PG seat here. So you go to the UK and you study PG there. I said, no, I'm not interested. Okay. Then they said, nothing doing. You are definitely going. So they made me take my IELTS exam, which is the English speaking skills exam for going to the UK and Australia. I scored a 9 out of 10 in the IELTS exam. Probably I scored 9 because it did not have anything to do with medicine. Then was the PLAB exam, which was the medical exam. They asked me to go take that exam. I said, I will not take it. They said, what backup plan or alternative do you have? I said, I don't know. They said, you have to give us a backup plan. I said, I do not know, but I know two things for sure. I love my city and I love my country. I will be somebody here than nobody in any other country. I took this conscious decision that day. And that day when I said this, I did not have any backup plan. My only backup plan was this. In Landmark, when I was going through a book, I read one single quote, which inspired me a lot. I went back to my house. I wrote it on the wall of my bedroom. I want each and every one of you to carry this particular quote home with you in your minds when you go. It is simple. If you don't stand for something, you will fall for anything. Please take a conscious choice that people around you, for good or for bad, even if it is your parents, even if it is out of good intentions, will always think well for you and pressurize you in their own way out of their concern. But the ultimate choice is yours. And because I took that choice, a break came to me. And do you know how breaks come to certain people? Certain people, breaks come simply because of their communication skills. And in my case, I've always had one mantra. There might be a very prominent personality sitting in this hall. There might be a not so prominent personality sitting in this hall. But at the end of the session, if both of you come and say hello to me, I will do my best to make sure that I remember both your names. Because you do not know in life who helps you where and who gets their break when. Simple example. I have never met Mr. Samuel Eddy other than an interview which I had gone to in NDTV. He came and he said hello to me there. This was about 3 years back. Here I am at SAM Global today talking to you because he invited me. Likewise, I got a good offer to run a group of hospitals. I was like, running a group of hospitals? Here I am sitting and treating patients. How do they trust me with a group of hospitals? I thought it was not my piece of cake. I should not take it up. But then the other pressure of my folks asking, so what else are you going to do? Was also nagging me. So I thought, I either have to take this up or I have to go to the UK. So I thought, okay, fine. If I take this up and try my hand at this, at least I stay in Chennai. I took that job up. When I took that job up, I got power. And because of power, I got responsibility. As Spider-Man puts it, with great power comes great responsibility. So, I got into this group of hospitals. I go in on the first day. I see all the doctors looking at me like, I was 30 years then. I see all the doctors looking at me like, brother, son, kiddo, your age is my experience. So you expect to command and us to follow you? You must be kidding types. But I knew that the world is changing today in such a way that life is full of challenges. What mattered was to make that difference irrespective of age. Youngsters or older people, if you prove yourself, you can rule the world. I taught my hospital only this. Whatever you do, it is a hospital industry. It does get you money, but it is hospital, treating human lives. Do anything that you do with a human touch. As Abraham Verghese, a TED speaker, has aptly put it, which comes in a beautiful video where he says, you are a doctor, treat your patient like a human being. touch the patient, examine the patient, do what is good for him, spend time with him. This is what I teach all the people who are in my hospital. And because of that human touch, nothing prevents anybody from growing up as a hospital, and that is why we are what we are today. Today, our hospital is a group of 3 hospital, super specialty, with so many beds, catering to so many people all over Chennai and all over Tamil Nadu. And I, to think that have been a small part of it, would probably say I'm not very proud of myself, but I've at least done something in life. And to conclude, I'd like to say a few examples. What would my best health quote to all of you be? Number 1, always smile. Number 2, make at least 4 people around you smile. Keep it as a mantra every day. You might meet 40 people, 100 people, 200 people every day. What does it take to make 4 people in that smile every day? It's not very difficult, right? You can look at somebody and say, you're looking gorgeous. You can look at somebody and say, your shirt is nice. You can look at somebody and say, this food is yummy. Make 4 people at least smile every day. I think that is the secret to the first stepping stone to a life free of stress, be it physical or mental. Second thing is, I want all of you to develop an awareness on 2 important diseases. One is heart disease, the other is cancer. I am sure that in this auditorium, there will be at least a few people who've lost their near and dear ones to heart attacks and cancer. Lift your hands. There are quite a few, actually. So please get your parents, your relatives, not in my hospital, in any hospital, screened regularly for heart diseases, diabetes, and cancer diseases. If you screen them regularly, there is a good chance that you prevent it at an early stage. Last 2 things I would like to say. Once upon a time, we used to identify people in Madras city by the cars that they drove. If you had a Mercedes, you are this particular producer. If you had a BMW, you are this particular industrialist. Today, we do not have count. We lose track over the number of Mercedes and BMWs that are there. People are not identified by their cars anymore. People are identified by the people that they are. So even though I am the director of a group of hospitals, I take my own pain to not be identified by my profile. I rather struggle till this day to be identified as a better human being and not as a high-profile person. I wish each of you who reach great heights in your respective professions follow the same thing. Because if you set your heart and mind to it, there is no turning back. The sky is the limit. I went to one college. Okay, let me give you the name of the college. I went to DG Vaishnav College to give a speech. In DG Vaishnav, there are DG Vaishnav students here. In DG Vaishnav College, I was addressing the MBA students. So they asked me, how are you a successful administrator? I told them the answer is, it is because I'm not an MBA in hospital administration. And what is most surprising is, I am one of the directors for the Board of Studies for MBA in DG Vaishnav College today. So, if you are practically good in what you do, it is not necessary that you have to be qualified to be that on paper. Take home that message with you, okay? And on this note, I'd say, there are miles to go before I sleep. And no matter what, all of you remember, life is always beautiful. Thank you.
Thank you.